OET Nursing Roleplay Script, Nurse and Patient. Setting, a general practice clinic. Patient, Mr. James Carter, a 45-year-old office worker, presented with a persistent cough and fatigue. Nurse, Nurse Emily Watson, a registered nurse conducting an initial assessment. Scene start. Nurse, warmly, good morning, Mr. Carter. I'm Nurse Emily Watson. How can I assist you today? Patient, coughing slightly, morning, nurse. I've been feeling off for a few days now. I've got this cough that just won't go away, and I'm really tired all the time. Nurse, I'm sorry to hear that. Let's get a better understanding of what's been going on. Can you tell me when the cough started and what it's been like? For example, is it dry? Or are you bringing anything up? Patient, it started about a week ago, I think. At first, it was just a tickle, but now it's more of a deep cough. I've been coughing up some phlegm, yellowish stuff. It's worse at night, and it's keeping me awake. Nurse, that sounds quite uncomfortable. Have you noticed anything else, like a fever, shortness of breath, or any pain when you cough? Patient, yeah, I felt a bit warm sometimes, but I haven't checked my temperature. No real shortness of breath, but my chest feels tight sometimes, and it does hurt a bit when I cough hard. Nurse, okay, thank you for that. I'd like to take some observations to get a clearer picture. Could I check your temperature, pulse, and oxygen levels? It'll only take a moment. Patient, sure, go ahead. Nurse, simulating actions, I'll just place this thermometer under your tongue. Hold it there for a minute, and here's the pulse oximeter for your finger. Pause. All right, your temperature is 37.8 degrees Celsius, so it's a bit elevated, and your oxygen saturation is 96%, which is within normal range. Your pulse is 88 beats per minute. How's your energy been overall? Patient, honestly, I've been wiped out. I can barely get through the day at work. I just feel run down. Nurse, that makes sense with what you're describing. It could be a respiratory infection, possibly something like bronchitis, but the doctor will need to confirm that. Have you had anything similar before, or do you have any conditions like asthma or allergies? Patient, no asthma, but I do get hay fever in spring. Nothing like this, though. I'm just worried it might be something serious, like pneumonia or something. Nurse, I understand your concern, and it's good you've come in to get it checked. Pneumonia is a possibility with a persistent cough and fever, but there are other signs we'd look for, like severe shortness of breath or very high fever, which you don't seem to have right now. The doctor will likely listen to your chest and might order a chest x-ray if needed. For now, can I ask if you've been taking anything for the symptoms? Patient, just some over-the-counter cough syrup, but it's not helping much. I've been drinking tea with honey, too. Nurse, that's a good start. Honey can soothe the throat. The cough syrup might not be strong enough if there's an infection. I'd suggest keeping up with fluids, and you could try steam inhalation to help loosen the phlegm. Just pour hot water into a bowl, lean over with a towel over your head, and breathe deeply for about 10 minutes. Does that sound manageable? Patient, yeah, I can try that. But what if it gets worse? I've got a big project at work, and I can't afford to be off too long. Nurse, I completely get that. If it worsens, like if you start feeling very short breath, the fever spikes, or you feel much weaker, please come back or call us right away. For now, rest as much as you can, even if it's just short breaks during the day. I'll pass all this on to the doctor, who'll see you shortly. They might prescribe something stronger, like antibiotics. If it's bacterial, do you have any other questions before I step out? Patient, how long do you think this might last? I just want to know what I'm in for. Nurse, it's hard to say exactly without a diagnosis, but if it's a typical respiratory infection, it could take a week or two to fully clear, especially the cough. It tends to linger. With rest and the right treatment, you should start feeling better sooner. We'll know more after the doctor's assessment. Anything else on your mind? Patient, no, that's it for now. Thanks for listening. I feel a bit better just talking it through. Nurse, smiling, I'm glad to hear that. It's what I'm here for. I'll let the doctor know you're ready, and we'll take it from there. Take care, Mr. Carter, and I hope you're feeling better soon. Patient, thanks, Nurse Emily. Nurse, you're welcome. I'll be back with the doctor shortly.